So what we see here with the scan, on this side, we see what a normal sample would look like, and over here we see what our patient's actual scan looks like. So what we see with the normal, the red is the most amount of pressure, then yellow, and then green, and then blue. So we see in this area here on the ball of the foot, we should have a lot of pressure. Same thing down here at the heel. We have 3 arches here, this lateral arch, this medial arch, and then the transverse longitudinal arch through here. And where we have that, we call that the plantar vault. And where that vault is, we should have very little pressure. There's 3 arches there to support. And so we could see with hers, and we'll turn it into color in a second, we're going to see that she's missing the lateral arch, or the outside of it. Her medial arch is intact, but the lateral arch is missing, meaning she's pronating the feet. And with that, we can see actually what it's doing to her pelvis. We can see that it's tilting the pelvis, it's torquing the ankle, rotating the knee in, torquing the pelvis this way, and dropping the shoulder on the opposite side down. So again, you can see here that these lateral arches are now missing here. We see still she's maintained some of the medial arch in the green area here, but you see even at the toes, excess pressure past the ball of the foot to the toe, and then this whole outside arch here. We're going to see now as it's going to turn, we're going to see what it looks like on the outside. And we're going to torque some of these angles so you can see exactly what her scan looked like. This is the posterior, the back of the foot. We're seeing the actual heel itself here. And this is going to show us, we're going to look at the actual arches. And what we can see with hers is that her 2 arches, even though she does have some medial arch, the 2 arches are actually different. So you can see as I'm pointing the mouse here, the one arch on one side is a little lower, this one's a little deeper. So she's walking on 2 different feet, and what that's doing, that throws the whole pelvis out of alignment. That changes up the kinetic chain. So from the ankles to the knees to the hips to the pelvis, throughout the kinetic chain is different. So as we turn them to the side here, we're going to see, look at the actual arches themselves here. They're different from side to side, so it's affecting everything. So she would be a great candidate for spinal pelvic stabilizers, and what those would do is help her hold her adjustments better and support everything from the bottom of the kinetic chain up. You can see here there's a significant amount of force that enters in the heel strike, moves up the kinetic chain to the knee, to the hip, and up to the spine, and literally still 10% of the total force from that heel strike is actually still hitting her right in the neck. And so it's actually contributing to some of the problems she has with her neck, middle back, and lower back as well, not only pain on the bottom of the feet or the plantar fascia. So we do use these products to go along with our chiropractic care, again, to help people hold their adjustments and help just support the arches and prevent injury, prevent ankle injuries, foot injuries, knee injuries, hips, and even spinal injuries as well.